My name is Brian MacArthur, and as Acting Deputy Vice-Chancellor and Head of the College of Law and Management Studies, it is my absolute pleasure to present the welcome message.
É meu prazer fazer a apresentação do discurso das boas-vindas.
Representing the chairperson of the African Ombudsman Research Centre Board and president of the African Ombudsman and Mediators Association and the Public Protector of South Africa, we're delighted to welcome Deputy Public Protector of South Africa, Advocate Golega Galeka. To Dean and Head of the UKZN School of Law and member of the African Ombudsman Research Centre Board, Professor Managay Reddy. To our esteemed panel, Public Protector of Zambia, Honourable Caroline Sokoni, Ombudsman of Lesotho, Honourable Tseliso Mokoko, Chairman of the Human Rights Commission of Zimbabwe,
Both, please unmute yourself.
Thank you, Frankie. Not quite sure how much of that you would have heard. Where should I start again?
Please,
I think I was on the Ombudsman of Botswana. Ombudsman of Botswana, Honourable Augustine Magona Thotsle.
Dr. Augustine Magona Thotsle.
Excellencies and Honourable Ombudsman who are able to join us.
Provedores de Justiça que puderam estar aqui conosco hoje.
Members of the media. On behalf of the Vice-Chancellor and Council of the University of KwaZulu-Natal, it gives me great pleasure to welcome you to the first webinar session to be hosted by the AORC in 2021. I trust that you managed to get a much needed and well-deserved rest over the festive season, despite some of our regions experiencing the second wave of the COVID-19 pandemic. We are all no doubt aware of the impact of the new variant of the deadly virus in South Africa, which has led the government to reverting back to level 3 of the lockdown that is currently affecting the lives and livelihoods of communities. The latest statistics from the Africa Centre for Disease Control and Prevention show that our continent currently has over 3 million cases of reported infections and approximately 76,000 deaths. It is, however, reassuring to also know that we have over 2.5 million recoveries. The southern region is mostly affected, with over 1.5 million cases, followed by the northern region with just over 1 million cases. The eastern and western regions have just below 500,000 and the central region below 100,000 cases. Thus, there are significant variations across the continent with countries at different stages of the resurgence of the virus. This pandemic is a massive challenge to the continent as we are faced with a large population of vulnerable communities, inadequate infrastructure, lack of good governance, poverty and famine, amongst many other socio-economic ills. Therefore, now more than ever, the African Ombudsman institutions are required to rise above these challenges and be at the forefront of protecting the rights of citizens as governments are grappling with curbing the spread of the virus, conducting tests and screenings, accessing medical supplies, saving lives while protecting livelihoods. I look forward to hearing from our esteemed panel as to how various ombudsman offices in Africa have dealt with these challenges presented by the pandemic and the systems that have been put in place to ensure that the Ombudsman institution remains accessible to the most vulnerable citizens. I'm confident that the sharing of best practices today will enhance the capacity of Ombudsman institutions throughout the continent. With these few words, I welcome you to the first webinar of the AORC in 2021, and I know that you will find today's session enlightening. It is now my pleasure to hand over to Advocate Kaleka, who will now formally welcome you on behalf of the chairperson of AORC. Thank you very much.
Un grand remerciement pour AORC.
I thank you, Facilitator and Public Protector of Zambia, Honorable Caroline Sokoni,
La protectrice de Zambie,
AOMA Regional Coordinator for Southern Africa and Ombuds of Botswana, Honorable Augustine N.
de Botswana,
Oakland,
Honorable Monsieur Augustin,
Ombudsman of Lesotho, Honorable Sidiso Mukoko, Chairman, Human Rights Commission in Zimbabwe,
Président,
Commissioner,
National de
Executive Director of the Mediator of Côte d'Ivoire, Mr. Dauda Tannen, Deputy Vice Chancellor and Acting Head of the College of Law and Management Studies at UKZN, Professor Brian MacArthur, esteemed panelists, distinguished guests, members of the media, ladies and gentlemen, I greet you all. From the outset, let me take this opportunity to convey the African Ombudsman and Mediator Association, President and the Public Protector of the Republic of South Africa, Advocate Busisiwe Mkhwebane, warm greetings to you all. Advocate Mkhwebane would have loved to be here. However, she has taken a well-deserved break to just take a rest. 4 years,
depuis 4 ans,
tenure.
elle travaille.
I am representing her here as the acting public protector for the tenure on which she will be on leave. She will be back in no time, and she all of us all of the best as we embark on this discussion today, reflecting on the challenges that the Ombudsman is facing during this pandemic. Let me start off by thanking African Ombudsman Research Center, AORC staff, for putting together this pertinent dialogue. In the same vein, I would like to express my sincere gratitude again to the University of KwaZulu-Natal for their continued partnership and support. And to all the participants who have taken the time within our hectic schedules, especially during this time when we have to juggle from one point to the other to make sense of the period we are in, and at the same time to resolve the challenges within our respective countries that is expected of us as Ombudsman. AORC continues to strive to be the center of excellence in Ombudsman studies and practices and in providing support to the Ombudsman institution in Africa. This ambitious vision rests on our 4 pillars, namely the research, information sharing, capacity building, and advocacy. Today's discussion gives effect to 2 of the pillars, being information sharing and capacity building, which is pertinent to us as ombuds during this time. We have to put together and ensure that we strive for strategic agility during this time. And there is no best time to learn from each other and share best practices, as Prof. MacArthur has alluded. COVID-19 has indeed impacted the world in ways none of us saw coming. This virus has wreaked havoc, disrupting the functions of organizations worldwide. And I am certain that none of our respective officers have been in this kind of a position. However, we must take the opportunities that are being presented by this disruption. Opportunities to be more innovative, opportunities to broaden our horizon in respect of the work that we do. Opportunities not to only learn from ourselves as Africa, but to learn from the globe. This is the opportunities for us to spread our wings in order to overcome our challenges. As Ombudsman particularly, we are faced with both internal and external challenges. Our external challenges putting more pressure on our internal challenges in order to ensure that we are able to resolve, we are able to be the pillar of society, the
Nós
citizen.
somos o pilar de uma sociedade.
DPP, please unmute yourself.
Sincere apologies. I wonder where did I get lost?
Eu peço as minhas desculpas e
It
ficou
is
aqui a
on my
pensar.
side. It is on my side.
A partir de que momento é que eu perdi
I was
a
trying
fita?
to remove the interpretation because we can all hear it. Please hold on, DPP. I will tell you when to start again. Interpreters, please go into your booth. Please select your booth so that we don't hear you. Go into your booth, select your language so that we won't be able to hear you. Thank you. DPP, please carry on.
Thank you.
Pode continuar, Provedora de Justiça Adjunta. Muito obrigada.
Investigation work has clearly slowed down as we
O
struggle
trabalho de investigação
to get responses to
foi,
queries
de facto,
sent
afetado.
to state functionaries. As more people have been infected by the virus, some offices close from time to time. We are not in a position to go to the far-flung areas to give access to the poorest of the poor. However, we need to make means to ensure that we are able to service those who are most in need, especially during this time. In these circumstances, we have to find ways of being just as effective and efficient as
Nós
we
temos que encontrar maneira de ser o quanto mais eficientes possíveis.
Thinking is not an option. We have
Pensar não é uma opção.
to
Temos
carry
que
each
pensar.
other.
Temos que partilhar com
Most of the staff is
a
working.
maior parte dos
This
funcionários.
gives us an opportunity to learn, an opportunity to enhance technology, an opportunity to really introduce ourselves into the fourth industrial revolution.
Portanto, estamos diante de uma oportunidade.
It is not smooth sailing. As we look at our internal challenges, some of the staff being infected, their families being affected, at the same time, we look into the outside world. We have to pick up on the things that are challenging to the people of South Africa and the globe and the continent, particularly as the African
Temos
Union.
que escolher resolver as
Our
coisas que são
country,
sensíveis às
We
pessoas
have
na África.
started investigating matters that are affecting the citizens administratively that are related to COVID, the administration of grants, the funds in our Solidarity Fund on COVID. Recently, we've seen in the newspapers how the disabled people receiving grants are left stranded in queues overnight, waiting for the renewal of their grants, clustered in the queues during the time of the pandemic. It's challenges that we face as the Ombuds, it's solutions that we have to come up with as the Ombuds, not only for our own innovations and doing things differently, but for those of state institutions which must continue to provide services to the people. However, bearing in mind that the system is quite strained during this time. Despite all of this, we are really making strides. As South Africa particularly, in December, we have released our interventions report into the state of the healthcare system in South Africa, which is much pertinent during this time. We are really hoping to receive positive feedback from government, as this not only gives an opportunity for government to be able to fight the pandemic, but it gives an opportunity to government to really improve, to reconstruct the healthcare system and its facilities in South Africa. Having made mention of that, colleagues, I am only illustrating that we can only take the challenge that this virus is presenting as opportunities,
aproveitar estes desafios do vírus,
our skills and our outreach as the Ombuds, but also to better administrative justice,
melhorar
better social justice for the people of Africa.
a justiça social para o povo de África.
In a nutshell, the advent of COVID-19 has forced us to learn new ways of achieving our goals in a hostile environment. It is always said that a crisis is more fertile ground to improve.
Portanto, é dito que momentos
We
de
have
crise
learned important lessons in the last 10 months. These are lessons we will draw from going into the future. We will never have the normal as we know it. Let's prepare for the new world. Let's prepare for the new era.
devemos nos preparar
Let us
para o
help to build and rebuild a better Africa. I look forward to hearing from you as to how you have dealt with your challenges in your respective countries. After all, we are here to trade our stories, to exchange ideas, to share best practices and learn from each other. I wish you all the best in the discussions. Thank you.
Madam Saccone.
Thank you so much. I would like to thank Professor Brian MacArthur and the Deputy Public Protector, South Africa, for those revealing comments and comments which will help to guide this discussion today. I'm pleased to be facilitating this discussion themed Challenges Posed by COVID-19, organized by the African Ombudsman Research Center, which has been instrumental in organizing these webinars during this pandemic. Would like to thank you, Frankie and Marian and the whole team at AOMA for bringing us together to share our experiences, to learn from one another in this new normal. Indeed, the outbreak of COVID-19 has caused significant social, political, and economic consequences worldwide. It is a global crisis, a great challenge, and as well as being a health crisis, it is also a human rights crisis. And this is the reason why we're sitting here today together. as especially for ombudsman institutions, when it comes to service delivery and ensuring that our people continue to have access to quality services. Today's topic is very important, especially with the outbreak of the second wave of the COVID-19 pandemic, which has been recorded in several African countries. And as Professor MacArthur has pointed out, Southern Africa having over 1.5 million cases, North Africa, 1 million cases, East and West Africa reporting over 500 cases each. So this is an issue which is to have all of Africa coming together and to start talking as we are doing now. So today's webinar gives an opportunity to share experiences of our countries in terms of what measures have been put in place by our governments, how the ombudsman institutions have contributed to these measures, and how COVID-19 has impacted on our work, what we have done and continue to overcome these challenges, among other things. In other words, today's discussion focuses on the challenges brought about by COVID-19 crisis and the strategies being used to tackle them. Therefore, without taking much of your time, as you can see on the program, my job is only to facilitate and hear from our speakers, who will be given 15 minutes each to make their presentations. Later on, if time allows, we'll endeavor to provide responses to the questions which will be posed during the discourse. However, participants should not worry because all the questions and answers will be made available.
Os participantes não devem se preocupar.
Websites.
Todas as perguntas poderão.
Few words before I invite the first speaker. Might I request our technical support to ensure that the interpreters don't really interfere with the speakers as they are speaking. Just that assistance, please. Maybe one of the housekeeping rules apart from the 15 minutes time. I will now proceed to invite the first speaker, Honorable Seliso Mokoko, Ombudsman of Lesotho. Ombudsman Mokoko has been an advocate of the High Court of Lesotho and Courts of Lesotho since 1999. He's a former Principal Secretary in the Ministry of Local Government and Chieftainship, as well as the Ministry of Defense and National Security in that country. It is with great pleasure that I now call upon Honorable Seliso Mokoko, the Ombudsman of Lesotho, to make his presentation. Ombudsman Mokoko. Ombudsman Mokoko. I think Ombudsman Mokoko may not be ready. He is.
Hello.
Mokoko, welcome.
Can you hear me?
Yes, we can hear you. We have just introduced you and we are inviting you to make your presentation, sir.
Thank you very much. Thank you. Greetings to you all, my colleagues and the invited guests. Simply, I will just briefly tell you about the structure of the Office of the Ombudsman. It's a very small office that has about 8 investigators and about 3 administration officers, 4 drivers, and 3 registry officers. These are people who are very critical in the day-to-day running of the office, especially as regards the services that the office provides. And this office is the only ombudsman office in Lesotho based in Maseru, still centralized, and is expected to serve approximately about 2 million people. These are the officers who on daily basis interact with clients who come to the office for various services. Now, the next question that comes now is the methods of delivery of services that the office does. The methods of delivery of services come in different ways, but the most common one is the walk-ins. people who walk into the office of the Ombudsman then meet with the investigators to now present their complaints. And they will go through these other offices that I've just mentioned, and ultimately they will get to meet the investigators in the office. This physical interaction now helps the investigators to make an assessment of the nature of the complaint that is being brought to the office. Then whenever there is a need also to hold meetings or to hold an inquiry, especially when the matter that may be brought to the office of the Ombudsman is of that public interest, now the Ombudsman may decide to hold an inquiry and invite members of public and the media houses for such an inquiry. Then once the complaint has been brought to the attention of the Ombudsman, then in order to dispose of that complaint speedily, the Ombudsman may call a meeting to discuss the complaint with all the relevant parties. And as soon as the investigations have been completed, now another meeting may be called where the Ombudsman may now deliver his determination. So in a nutshell, all these interactions are done physically with investigators and the clients who come to the office for assistance. But the unfortunate part is that at the moment, there are no digital programs for all the services that the office offers because of the financial constraints that the office has been encountering. Then I'll quickly get to the issue of technology. The office has in place the case management system. That is something that would have been very useful, especially during this COVID-19 pandemic. But that system has not been operational for quite a long time. And because of the budget constraints that are there, the system has not been upgraded and still remains the ground. And it means now people who come to the office now are not being given the services that they otherwise could have received if the system was operational. But because of the lack of funding now, there's the problem that now this system cannot be now enrolled. Immediately after the pandemic now was felt, its impact now was felt, the government moved swiftly now to cut the ministry's budgets. And this had a very negative impact on the operations of the office, because now all the infrastructures that were to be put in place, the systems that had to be put in place could not be put in place because of those budget cuts. Now, currently, staff does not have enough tools, not enough data. Therefore, it makes a huge difficulties for the office now to interact with clients virtually because of non-availability of such tools. Now, this has really impacted negatively on the operations of the office, and as such, clients now are feeling the impact of that shortage of funds, which has also affected now the digital programs that the office would otherwise have.
Le fonctionnement du bureau.
And another difficulty is that the office does not have control over all the matters or issues related to technology. All these are the responsibility of the Ministry of Communications.
Cela vient de la responsabilité du ministère de l'Information.
A demand for technological tools data, things like that, the ministry would always be given excuse that the ministry does not have enough funds to fund those operations. So that's actually really impacting negatively on the operations of the office. Now I'll immediately get to the challenges that are presented by COVID-19. As I have already alluded to the fact that the government immediately when this pandemic was rife in Lesotho, the government now moved to cut the budgets of the office substantially, and quite a substantial amount of money was taken from the office. That had huge impacts on the activities that the office had already planned for the financial year 2021 and 19-20 fiscal year. So the office now had to find means now to prioritize other activities at the expense of suspending and cancelling some of its activities that had been planned for that year. So that also had a huge negative impact on the operations and the goals that the office had targeted to achieve by the end of that financial year. Because of the restrictions now and the budget cuts, the office now had to suspend and cancel some of the activities. In terms of our law, the Ombudsman is now permitted to run and have inspections at various places such as the police cells, military holding cells, the refugee camps. But because of the restrictions that were put in place at that time, now this office could not therefore carry out with those inspections because of the restrictions that were put in place at that time. And also because of the financial constraints that now were as a result of the budget cutting, the office could not afford now to acquire and procure a proper PPE for now staff to use when going out to have these inspections. And for a number of times, the office had been receiving complaints about the inhuman treatment of people that were held at quarantine centers. But unfortunately, the office could not, go there to have those inspections because of non-availability of proper PE. And therefore, we took a decision that we will not put our staff at risk to go and have inspections of those areas while staff was not equipped with proper PPE. Therefore, it means those people who had to be interviewed to find the conditions that were allegedly prevailing at those centers, the office could not do that because of those challenges that the office was faced with. And there were also very pertinent inquiries that had been planned that had to be instituted, but those inquiries now had to be suspended because of the restrictions that were put in place. And those investigations or inquiries were planned to look into very serious public matters that public had an interest on, but because of the restrictions at that time, and because of lack of technology, because of the fact that I've already alluded to, then those inquiries had to be suspended. And really that has affected the matters that are of public interest that would have otherwise been resolved. And today they still remain unresolved. The office of the Ombudsman, as I have already alluded to the fact that it is only centralized here in Marcel. And Lesotho has about 10 districts, and most of them are in rural areas. So normally the office will now go out to have these outreach programs to educate people about the services that the office provides. And in those outreach programs, the office will also have complaints intake clinics where people will come and bring their complaints, and then the office will now go and investigate such matters. And that program is very critical and very important, because now office goes out to meet people instead of people having to travel all the way from their rural areas, come down to Maseru to present the complaints to the office. This program now, when it was suspended and cancelled because of the restrictions that were there, because of the pandemic, it meant that a lot of people who need the services, the poorest in the rural areas, could not get this service. And they still remain unheard to today. The grievances are continuing. So it is really impacting negatively on these people, because now we had to end these outreach programs or suspend them until the situations would have improved. And there were also other matters that were now had to be, heard and resolved speedily. And to do that, the Ombudsman would have to call meetings of all the complainants, all the relevant ministries, agencies, for meetings so that it can, make a determination or hear both sides. But because of the risks that were involved to have meetings, physical meetings and interactions with these other relevant stakeholders, such meetings were also suspended. But if the office had in place infrastructure, tools, data, as I've already alluded to that, this would have been easier, because the office would have virtual meetings with all the relevant offices. But our investigators are not equipped with data, the relevant tools, laptops, and so forth, so that those meetings could go ahead even during the time of the pandemic. And another striking factor was that our health system was overwhelmed by huge numbers of people now who were affected, infected by this pandemic. And also it meant that many of our staff at any point in time was not feeling well, had to stay home, and would not go to or would not be helped at these health facilities because of the high volume of patients that were being attended to there, who were more serious than anyone would be saying just having a cough. So these people now have to be taken home, will have to go under home care treatment, and they will take longer for them to get better, because now they were not being given the assistance at the health centers that they would otherwise be given. Then it meant that we'd have people staying at home for longer periods of time than expected. And at that time when these people are at home, also the operations of the office will be affected, and people who feel the pinch of that are people who the office is supposed to serve.
Honorable, you have
because of
you have 4 more minutes.
Okay. Because of the consequence of the pandemic, there was fear, discomfort among staff. They would be very reluctant to have clients because of the fears that are brought by the pandemic, and it affected their morality. And at the end of the day, the services that otherwise they would be expected to offer, we find that was affecting their competencies and the way that they would otherwise operate. There was also the general lack of adherence to the law, because now people were taking advantage of the fact that everybody knew that the office was not operating in a normal way, and would receive complaints that now people were not adhering to the law, because they knew that the office was not working at its normal, full scale. And that also, people were taking advantage of that situation, and it had a very negative impact on other people who were now being affected by actions of others who were not adhering to the law. But at that particular time, there was nothing much that the office could do. Now, the interventions that we put in place were to also to deprioritize some of our services to accommodate the constraint of the budgets that now we were having. We had to drop other and cancel other activities. I've already alluded to that. We also had to cut off physical contacts with clients in order to preserve lives. Yes, we are aware that now our staff was, feeling very discomfort to work in that environment. So we had to, allay their fears and cut some of the meetings. We also reduced the influx of walk-ins into our office by now putting the depository box at the office and encouraging clients just to deposit their complaints into those boxes, and encouraging them and going out to tell people that they can telephone the AORC offices for services and use email platform for that. We also used our Facebook page to inform people about the services that the office can offer, and also that had a huge impact on that. And because of the financial constraints that we had, we approached a lot of development partners for assistance in especially in matters of technology, to assist the office with the tools, infrastructure, so that the office can continue to function even during the period of this pandemic, because that is the only way when that the office can be able to operate, if it has the infrastructure, if the digital provision of services can be provided to clients. That would be of great assistance, and it would alleviate the office from the situation in which it is now, where these tools are now available. In a nutshell, that is the presentation that I've prepared for your colleagues to show the challenges that the office has experienced and the interventions that the office came up with. I thank you.
Thank you so much, Honorable Mokoko, for that detailed presentation. And it is good to hear what the institution of the Ombudsman in Lesotho is doing amidst this pandemic. Honorable Mokoko has highlighted the issues of the case management system, the budget constraints, which have caused a challenge in the operation of the Office of the Ombudsman, and the non-upgrading of the case management system, and also the issue that the office has not been able to visit the 10 districts in the Lesotho because of the restrictions that have been put in place because of the COVID pandemic. But of course, he has added that clients have been encouraged to give written submissions. They have been encouraged to also use the telephone, and that the office has also been using the Facebook page to try and reach out to members of the public. We are just happy that in spite of all the challenges that the Office of the Ombudsman is facing, there is still access for members of the public to reach the Office of the Ombudsman of Lesotho. Thank you so much for that detailed submission, Ombudsman. I will now move on to invite Honorable Commissioner Ilasta Mugwadi, Chairman of the Human Rights Commission of Zimbabwe. Honorable Mugwadi is also the Vice Chairperson of the Network of African National Human Rights Institutions. He is a former Chief Immigration Officer of Zimbabwe. Honorable Commissioner Ilasta Mugwadi, I have the pleasure of welcoming you to make your presentation. Honorable Mugwadi. Honorable Mugwadi, are you with us?
Please unmute yourself, Honorable Mugwadi, and mute your microphone.
Can you hear me now?
Perfectly, yes.
Thank you very much. I had just said thank you very much to the Honorable Madam Facilitator, Madam Sokoni, and may I hasten to say all protocols observed. Talking of the challenges posed by the COVID-19 pandemic in ombudsman institutions in Africa, it is common cause that the global COVID-19 crisis has occasioned a serious curtailment of certain fundamental rights and administrative justice to the general public as a result of the emergency measures adopted to contain the spread of the pandemic. As the ombudsman in our various jurisdictions, I reckon we have the duty to institute and implement mechanisms and strategies that are designed to mitigate the plight of the citizenry. Whilst the pandemic threatens to undermine democratic norms everywhere, the Office of the Ombudsman faces increased pressure to fulfill its constitutional mandate and, of course, in the process, safeguard its relevance. There is therefore need for us to come up with strategic responses to help our institutions capitalize on the significant opportunities to enhance our relevance and contribute to improving the lives of the citizens that we exist to serve. As independent pluralistic institutions established under the Constitution or the law in our various countries to promote, protect, and enforce human rights, as well as to protect the general citizenry against maladministration by government authorities and other public institutions, it is our duty to stand as guardrails to keep democracy on track. In the absence of safeguards for our own autonomy and accountability, we cannot, however, serve effectively in this role. We are legitimately well positioned to advise on the illegality of human rights derogations due to our expertise and knowledge in international human rights standards. We should relentlessly address individuals' complaints and work with civil society and other human rights defenders as the voice of the voiceless, in particular the most vulnerable, by fair reporting to national and international bodies. Madam Facilitator, on behalf of the Zimbabwe Human Rights Commission, I would like to extend my heartfelt gratitude to the African Ombudsman Research Center for giving me this honor and privilege to be part of this discussion, particularly on the COVID-19 related challenges which are being faced by the Ombudsman in these changing times, euphemistically referred to as the new normal. Specific regard shall be placed on the following issues in my presentation: how the Zimbabwe Human Rights Commission has remained accessible to the most marginalized and vulnerable citizenry. 2, how the Zimbabwe Human Rights Commission has fulfilled its mandate to protect the rights of the most vulnerable citizens in a timely and efficient manner. And lastly, what can be done to find meaningful solutions that are flexible enough to meet the changes brought about by the COVID-19 challenges. Madam Facilitator, you may need to know what the Zimbabwe Human Rights Commission is. Briefly, the Zimbabwe Human Rights Commission is a hybrid constitutional institution with a dual mandate, namely the human rights protection and the promotion mandate, and the administrative justice mandate. The Zimbabwe Human Rights Commission was set up specifically for the purposes of protecting, promoting, and enforcing human rights, as well as protecting citizens against maladministration by the state, its agencies, and any other public entities. In terms of accessibility, following the declaration of a national state of disaster by His Excellency the President of Zimbabwe on the 17th day of March 2020, regarding the epidemiological situation generated by the COVID-19 pandemic, the Zimbabwe Human Rights Commission, as the national human rights institution and a public protector, continued to carry out its constitutional mandate in the face of the new normal. We were therefore classified as frontline workers. With this commitment to ensure the health and safety of the public and its staff during these challenging times, complaints intake continued to be received and responded to according to our normal processes. Our office implemented a raft of measures to ensure full functioning and adequate attention to all those who needed to file their complaints or alternatively get legal advice and assistance. From the day when the national state of emergency was declared, our institution decided that practically all its employees start teleworking. Our services were made accessible during the various stages of the lockdown through the following modalities: the SMS, phone calls, WhatsApp and hotline services, social media, radio and television. Face-to-face consultations were temporarily suspended, but such suspension was gradually lifted as the lockdown restrictions were also gradually eased up. In cases where our complainants required advice, such advice was disseminated through phone calls, as we intended to minimize physical interaction. Social media continues to be utilized to disseminate important information to the public, as well as to receive complaints of violations of human rights by various governmental and non-governmental actors. When some restrictions were relaxed, we managed to carry out mobile human rights clinics and outreaches, especially in some remote parts of the country, with the aim of receiving complaints on violations that would have happened during the stricter stages of the lockdown and provide remedies to such violations. Currently, Madam Facilitator, complaints are being received and responded to in the normal processes, with the most urgent ones triaged or prioritized for quick response. Although response times in some cases may be slower because of the stakeholders with whom we regularly interact are also working remotely, we are, however, achieving important results. All complaints will continue to be assessed as long as they are submitted through our online services or via email and other such telephonic services. The challenges that we have faced and are facing on accessibility. Given that the new normal restricted the right of freedom of movement of people, especially those requiring the services of the Ombudsman through face-to-face consultations, it is evident in our observations that the new normal is ushered in additional challenges. One, lack of access to internet by some marginalized citizens. Not everyone has access to internet or a phone for the purposes of lodging their complaints. For example, in our society, namely, many elderly people and persons with disabilities face barriers on the internet because they do not have technological equipment to use for the purposes of accessing the internet, or accessible pages, or a system of accessibility adapted to their needs. 2, constraints on field visits and investigations. As the relevance, efficiency, and independence of the Office of the Ombudsman is dependent upon the ability to respond quickly and effectively in times of crisis, sometimes we could not be responsive to cases of violations of fundamental human rights due to the limitations on gathering and the general movement of persons. We could only attend to such other cases after the easing of the lockdown restrictions. 3, increased backlogs, especially in the investigation of cases. Due to the limitations on movement and the introduction of working remotely, some cases could not be investigated on time. In cases where we managed to carry out some investigations, it was difficult, if not impossible, to get our reports into the public domain or enforce implementation of the recommendations made. 4, limited financial capacity. The lack of adequate resources to carry out our constitutional mandate, especially timeous responses in the face of violations, was occasioned by late releases of financial resources by our Treasury. 5, non-decentralization of the Office of the Ombudsman in Zimbabwe. As an independent oversight institution, we are also facing the challenge of increase in the work related to the pandemic, which requires decentralization. With offices in only 2 provinces out of 10, timeous responses such as of urgent field visits are difficult, if not impossible, in light of the existing lockdown restrictions. I now come to the protection of rights in a timely manner. The biggest challenge for the Office of the Ombudsman is to remain relevant and responsive, as well as to manage limited resources to redress violations that take place in the context of COVID-19 pandemic. The Zimbabwe Human Rights Commission, Madam Facilitator, is focused on improving the effectiveness and efficiency of its services and the quality and the consistency in discharge of its protection mandate. In cases of infringement of fundamental human rights in the context of the COVID-19 pandemic, the Zimbabwe Human Rights Commission has continuously issued press statements reminding and urging the government of Zimbabwe's principal duty bearer and all its institutions and agencies to ensure the effective protection of the most vulnerable and exposed groups of our people, such as older persons, women, children, persons with disability, migrants, and the people living in poverty, as well as prisoners. The Zimbabwe Human Rights Commission has continuously reiterated in its statements the need for any COVID-19 related human rights restrictions to be necessary, proportionate, and non-discriminatory, and that human rights-based and equality principles should inform their implementation. The Zimbabwe Human Rights Commission has also tirelessly engaged and advised the government, its departments and institutions by giving guidance and support to enable them to adopt a human rights-based approach in the implementation of the lockdown regulations. I now come to the strategies to bring about meaningful solutions that are flexible enough to meet the changes brought about by the COVID-19 challenges. With the increasing demand for services of the Ombudsman Office, its role in this challenging environment requires a proactive, creative, and innovative approach to combat effectively the challenges posed by the COVID-19 pandemic. There is need for having clearly articulated outcomes supported by a fit-for-purpose structure, capable and competent staff, transparent and robust processes, impartiality and fairness, confidentiality, and a credible review process to guarantee a functional institution. Our priorities in the face of the COVID-19 pandemic, ladies and gentlemen, include increasing of citizens' awareness of our work. We have to ensure that we continue to communicate our work online and offline in a clear manner, using compelling language that is easy to understand. To engage with the government, its departments, agencies, and other public institutions on the broad range of issues of mutual concern, whilst always maintaining operational independence. Develop a participatory approach with our stakeholders and multipliers, such as civil society organizations, media, business community, and faith-based organizations, etc., etc. Expand cooperation with other regional and international bodies, such as the International Ombudsman Institute and AOMA. How have we ensured the relevance of the Zimbabwe Human Rights Commission to the Zimbabwean people in the context of this pandemic? We continue to endeavor to help people who seek redress and to identify proactively research areas of key importance to citizens and residents for possible systemic inquiries and initiatives. We continue to increase awareness of the changing dynamics of the Zimbabwean political, social, economic, and legal environment in which we operate, and where appropriate, engage in and contribute to relevant debates and the developments on democracy. Engage with and learn best practices from stakeholders and, of course, other ombudsman offices. We also endeavor to continue to improve our efficiency by ensuring that the Zimbabwe Human Rights Commission budgetary resources are aligned with its strategy.
Honorable, you have 2 more minutes. 2 more minutes.
We continue, yes, Madam Facilitator, we continue to improve as much of our processes as possible to maximize the effectiveness and efficiency of our work, for example, using digitalization. Continue to structure our office, work processes, and outreach in a flexible and adaptive way, while testing and learning new ways to enhance our impact. I need, therefore, finally to propose and recommend a few issues to be followed. That the Ombudsman Office continues to proactively monitor, report, and issue recommendations in a timely manner, leveraging relationships with civil society, the media, and the public to maximize outreach and effectiveness. 2, the Ombudsman Office should continue to modify procedures and the processes where possible by conducting oversight and providing efficient services to the public in line with its constitutional and legal mandate. 3, reassess and reorder priorities to fulfill the institution's objectives in the context of the persisting pandemic. 4, consider technological innovations that increase opportunities to effectively interact with the public and to improve information and access to services both during and beyond the crisis. Introduce new or revised cybersecurity protocols to ensure that necessary procedures and the training can guarantee continuation of services in remote work environments. Monitor executive action and flag instances of overreach or efforts to undermine accountability mechanisms. advise government on how to protect human rights while applying emergency measures, in particular for the most marginalized groups, and of course, monitoring compliance. Widely share information about the rights individuals can continue to enjoy during the pandemic, as well as how they can effectively get a remedy in the event of infringement. And finally, Madam Facilitator, report on human rights to international and regional mechanisms as required. Thank you for the indulgence, Madam Facilitator. That's my short presentation.
Thank you so much, Honorable Mugwadi, for that very comprehensive and detailed presentation. I think it has been an education for us all to listen to your presentation. I think what I can pick out from your presentation is how you have engaged all players during this pandemic. You have a program lined up not only for the general public, not only for your complainants. You are engaging civil society very actively. You are engaging with government very actively. You have programs laid out for each class of stakeholder that your institution is dealing with. And I'm very pleased, actually. This is a very, very good example to all of us as ombudsmen here in Africa. Thank you so much. With these few words, I will call upon our third and final speaker, Mr. Douda Tanon, Executive Director and Mediator de la République of Côte d'Ivoire. Mr. Douda Tanon is a retired economist and financial services administrator. He has worked at directorate level in several government and private agencies. He currently holds the position of Executive Director of the Mediator de la République of Côte d'Ivoire. I invite you, Mr. Honorable Douda Tanon. Monsieur Tanon.
Merci, bonjour Madame Sokoni. Ravi de vous revoir. Donc avant de commencer, je voulais au nom du médiateur Adama Tunkara qui est en mission.
Sorry to interrupt you, Mr. Dauda. Just to inform everybody that in order to hear Mr. Dauda in English, please select French on the interpretation. Go to the interpretation and select French, and the interpreter will be speaking in English. Thank you. Carry on, sir.
Merci, Frankie. Je disais donc au nom du médiateur Adama Tunkara qui est en mission à l'intérieur du pays, pour des missions de renforcement de la cohésion sociale. Je tiens à vous présenter mes vœux pour l'année 2021 à toute la communauté et aux ombudsman et médiateurs. Je profite également pour féliciter notre centre de recherche de Proie pour ses efforts afin de maintenir la flamme et qui, malgré les difficultés dues à la pandémie en cours,
Sorry, Mr. Tanon. Sorry, I will interrupt you again. I think, sorry for that. I think you just need to keep the English. Just keep on selecting English. Sorry, everybody select English and it will come in English. Thank you, sorry.
Ok, donc le thème du jour, c'est le défi du Covid au sein de l'institution de médiation ivoirienne. Donc, je ne vais pas faire l'historique de cette maladie. Donc, ma présentation va se décliner en 4 grandes parties. Les mesures, d'abord, dictées par le gouvernement ivoirien. La deuxième partie, c'est les dispositions pratiques prises par l'institution de médiation pour faire face à cette pandémie.
The English translation is not coming on.
Philip, select English, please.
Yeah.
C'est bon? It's okay?
Yes.
Okay, yes.
Donc, Je reprends rapidement. Donc, je voudrais dire que ma présentation, c'est sur le défi de la pandémie sur les activités de l'institution de médiation ivoirienne. Donc, en 4 parties, c'est d'abord les mesures édictées par le gouvernement, les dispositions pratiques prises par l'institution elle-même, l'impact de la pandémie sur nos activités et le traitement des réclamations pendant cette période. Je voulais donc signaler que le premier cas de Covid a été recensé dans le pays le 11 mars 2020, à Abidjan même. Il s'agissait donc d'un Ivoirien qui est revenu d'Italie avec cette maladie et qui a été rapidement pris en charge par les services des hôpitaux du CHU de Treichville. Rapidement, le ministre de la Santé va mettre en place un comité de veille et en collaboration avec les services d'hygiène de l'Institut Pasteur et les services des maladies infectieuses, a été mis donc en place des réunions, on tenu des réunions hebdomadaires pour coordonner les orientations stratégiques ainsi que les actions opérationnelles dans le cadre de la lutte contre cette pandémie. Le nombre de mesures qui précèdent les bonnes pratiques pour lutter contre la pandémie ont été édictées par le gouvernement, à savoir se laver les mains, c'est très simple, avec de l'eau et du savon comme tout le monde, ou des solutions hydroalcooliques. Tousser et éternuer dans le creux du coude, un mouchoir, saluer sans se serrer les mains, sans accolade, respecter une distance physique d'au moins 1 mètre entre les personnes, éviter les rassemblements de plus de 50 personnes. Le président de la République s'est adressé en mars 2020 à la nation et a mis en vigueur donc 13 mesures. Le Conseil national de sécurité a mis donc en place 13 mesures qui sont la suspension pour une période de 15 ans renouvelable de l'entrée en Côte d'Ivoire des voyageurs non ivoiriens en préférence des pays ayant plus de 100 cas confirmés. Généralement, c'était des pays européens. Les ressortissants ivoiriens et les résidents permanents non ivoiriens seront soumis à une mise en quarantaine obligatoire pendant 14 jours à leur arrivée. 2. Renforcement du contrôle sanitaire aux frontières aériennes, maritimes et terrestres. 3. Mise en quarantaine des cas suspects et des contacts des malades dans des centres réquisitionnés par l'État. Fermeture de tous les établissements d'enseignement scolaire pour une période de 30 jours à compter du 16 mars. Le respect d'une distance de 1 mètre entre les personnes dans les grandes surfaces, les restaurants, les entreprises. Le respect des mesures d'hygiène corporelle, hydrique, alimentaire, lavage de mains, etc., comme on dit tout à l'heure. Fermeture de toutes les boîtes de nuit, des cinémas et des lieux de spectacle pour la période de 15 jours. Interdiction des rassemblements des populations de plus de 50 personnes pour une période de 15 jours renouvelable à compter du 18 mars. Suspension de tous les événements sportifs et culturels nationaux. Ouverture des sites complémentaires équipés de prise en charge à Abidjan et à l'intérieur du pays. Gratuité totale du diagnostic et de la prise en charge de tous les cas. Donc, dispositions pratiques prises donc par l'institution elle-même qui nous concerne. La suite des mesures édictées par le gouvernement, le médiateur s'inscrivant dans cette lutte contre la pandémie a pris les mesures suivantes afin de protéger le personnel et les requérants. La sensibilisation des populations est faite à travers le site internet et la page Facebook de l'institution. Il y a une distribution gratuite de masques et de gel hydroalcoolique au personnel. Contrôle systématique de la température et de lavage des mains obligatoire à l'entrée de l'institution et des délégations régionales. Parce qu'en plus de l'institution, nous avons une dizaine de délégations à l'intérieur du pays. On a mis en place une rotation des agents, une espèce de shift comme on dit en anglais. Pendant 2 jours, les agents se relayaient pour respecter la distanciation. la suspension au siège et dans les délégations de toutes les séances d'écoute de plus de 50 personnes, ainsi que la suspension des réunions de coordination du médiateur de la République que nous avons pu tenir pendant quelque temps par visioconférence. Maintenant, pour parler de l'impact réel de la pandémie sur les activités de l'institution, il faut signaler que la crise qui a atteint son épicentre en Europe au mois de mars a affecté la vie des populations ivoiriennes comme de tout le monde, tant au plan national et international. Au plan national, après le premier cas détecté en mars, le nombre d'infectés n'a cessé d'augmenter, atteignant 25 le 22 mars. Cette évolution rapide de la maladie a impacté de façon considérable les activités de l'institution. En effet, face à cette situation d'urgence, le médiateur, en conformité avec les décisions du gouvernement, a modifié les horaires de travail de son personnel, suspendu, comme je dit tout à l'heure, la majeure partie des activités sur toute l'étendue du territoire. Ces mesures avaient pour objectif de faire front à la pandémie en limitant les risques de contamination pour le personnel de l'institution et pour ses agents. Tous les séminaires, les ateliers, les audiences accordées aux usagers et les tournées de sensibilisation ou de conciliation ont tous connu un arrêt. À titre d'exemple, l'activité de sensibilisation à la paix et à la cohésion, dénommée les grandes rencontres du médiateur avec les populations, qui a débuté en février dans l'ouest du pays, devant se poursuivre dans toutes les régions, parce que nous avons 31 régions, a connu une pause. Donc, l'institution ne va tenir qu'une seule grande rencontre avec les populations pour sensibiliser à la paix. Vous savez, une des spécificités de notre institution, c'est de travailler à la cohésion sociale. Donc, en plus des missions de l'Ombudsman, le médiateur est chargé des missions de conciliation entre les communautés, et surtout en période électorale comme nous avons connu et que nous mettrons bientôt. L'impact de la pandémie a été flagrant sur l'économie, donc les budgets de l'État ont connu une réduction. Ça a joué sur notre institution qui a reconnu une légère baisse de son budget. Donc ensuite, sur le plan international, comme vous pouvez le savoir, la preuve c'est qu'aujourd'hui nous travaillons en visioconférence. Toutes les rencontres qui devaient avoir lieu à l'étranger, que ce soit dans le cadre de l'AOMA, de l'AOMF, de DECAF, nous avons tenu par visioconférence. Traitement donc des réclamations en situation de Covid. Au niveau des réclamations, le travail de tous les jours de l'institution, ou ce que vous appelez les enquêteurs qui interviennent, nous avons connu un ralentissement certain dans le traitement. Et face à l'accélération de la pandémie, nombreuses administrations mises en cause étaient injoignables parce qu'ils avaient fermé, ils avaient mis en place des systèmes de rotation, de shift également. Donc, il était impossible aux enquêteurs de pouvoir parler aux mises en cause. Donc, c'est dans ce sens que le système de rotation mis en place par l'administration publique en général ne facilite donc pas le traitement des réclamations. Les agents des structures ou administrations mises en cause ne travaillant plus de façon permanente les jours à venir et se relaient. Cette situation créait comme conséquence une difficile rencontre des mises en cause pour faciliter leur avis sur certaines réclamations et pour poursuivre éventuellement les procédures de médiation engagées. D'autres structures mises en cause dans les réclamations préféraient qu'il n'y ait pas de déplacement en leur sein pour protéger eux-mêmes et protéger leur personnel. Donc, il y a eu donc une baisse du nombre de nos interventions sur le terrain. Donc, au terme de la présentation, il faut constater que la situation du Covid demeure très préoccupante en Côte d'Ivoire, même si le gouvernement a assoupli et levé les mesures de lutte au moment où une seconde vague sévit durement dans les pays européens et adoptent des mesures strictes de confinement afin de protéger la population. Il appartient donc au gouvernement de ne pas baisser les bras, de ne pas baisser la garde et continuer d'inviter les populations ivoiriennes à toujours respecter les bonnes pratiques et depuis le début de cette crise sanitaire très préoccupante. Je vous remercie, Madame Sokoni. Je pense que je n'ai pas été plus long que prévu. Merci.
Thank you so much, Mr. Tanon, for that incisive presentation, and thank you so much for sticking to time. Mr. Tanon has enunciated the measures which have been taken by the Office of the Ombudsman in Côte d'Ivoire, that they continue to sensitize the population using their online services. They were very active in that, and that they continue to have accessibility, to offer accessibility to members of the public, but by ensuring that there was a work roster in place which was provided, and that work roster has been in place throughout, and that although the coordination of meetings of the Ombudsman was suspended, but at all times they modified the working timetable in order to limit the risk of contamination, but still endeavored to use the work roster system for members of the public to have access. And that also the president, of course, had put in place travel bans. There was a quarantine. Education institutions were closed, and although companies were closed and places of entertainment were closed, still the office of the mediator in continued to provide its services. So we thank you so much for that presentation, Mr. Tanon. I think we have 5 more minutes. It is now 11:25. I think we can take 1 or 2 questions. We have a question from Mr. Tobani Kobo, and his question is, what is the value proposition of the Ombudsman in the protection of the citizens of human rights against unreasonable government regulations during the COVID-19 pandemic? And the second question is, what are the successes and failures of our Ombudsman during the COVID-19 pandemic? The first question, I think I will give to Honorable Commissioner Elasto Bugwadi. If you can kindly, sir, answer that question for us. And then the second question, what are the successes and failures of our Ombudsman during the COVID-19 pandemic? I will invite all our 3 presenters, if each one of them can give us just a brief summation to that question. Thank you so much. I invite Honorable Commissioner Mugwadi.
Unmute your microphone, sir. Commissioner Mugwadi, please unmute your microphone. Unmute, sir. Yeah.
Yeah.
Perfect.
Am I audible now?
Yes.
Can you hear me?
Perfectly.
Yes. Yes. I was saying, you know, in the event that there is violation by government and any other state actor in terms of the legal frameworks that they will be implementing, which ostensibly violate the rights of the citizenry, it is the duty of the Ombudsman as advisor to government on statutory issues to also flag that down and make recommendations to government. If I got the question well, I'm sure, you know, our governments are amenable to advisories from us as the Ombudsman and even as human rights institutions. And in any case, there's a very thin line between what is a human rights violation and administrative justice violation. They are almost one and the same. This is why there was justification in our case and a few jurisdictions that the office of the Ombudsman is not separated from the human rights office. So my response briefly would be to advise government, because that is one of our roles.
Thank you so much, Honorable Mugwati. I think maybe not to take away anything from what Honorable Mugwati has said. I think the biggest advantage that the Ombudsman institutions have is that they are there to investigate human rights breaches and acts of maladministration by governments. Government never stops working. 24/7, government is working. So even if there is the COVID pandemic, even if we have to have social isolation, even if we have to quarantine, government has to continue working. Government is the one that is running our health institutions. And if the office was created specifically as an oversight institution over government, the Office of the Ombudsman was created specifically to have oversight over government. That is the value proposition for the Office of the Ombudsman, that it is always there. And I think I can commend the government of Zimbabwe. This is the reason why I directed that question to Honorable Mugwati, because he said that the Office of the Human Rights Commission in Zimbabwe was categorized as a frontline institution during this COVID pandemic. I think if I heard you right, Honorable Mugwati. So it made it so much easier. Yes. So it makes it so much easier once the government also recognizes the important role of the Ombudsman institution. Maybe I may ask the remaining Ombudsman. It is already 11:30, but please, if you can comment very quickly on the second question. What are the successes and failures of our Ombudsman during the COVID-19 pandemic?
I will start.
Honorable, yes, Mr. Tanon, you may start.
Je voudrais donc parler d'abord des échecs. Quand vous parlez d'échecs, ce n'est pas échec en tant que tel. La première chose que je dirais, c'est une baisse des saisines de l'institution à cause du confinement. Et malgré les mesures prises par l'institution, nous avons déploré au sein de l'institution 2 cas d'infection qui ont été rapidement pris en charge et qui n'ont pas infecté d'autres personnes. Ça veut dire quand même ce qui a été mis en place nous a aidés. Ensuite, les succès, je voudrais dire, malgré le confinement, nos bureaux ont été ouverts, accessibles au public en toute la période. Et nous avons réussi à dérouler la majeure partie de notre programme d'activité de l'année 2020. Je vous remercie.
Thank you so much, Mr. Tanon. Honorable Mokoko, do you have an intervention? Honorable
Hello?
Mokoko, yes, please.
Yeah, can you hear me?
Yes,
Yes, can you hear me? Okay, thank you. I think one of the successes that we had was that despite the pandemic, we managed to put in place measures within which we could still continue to offer services to people who needed the services of the Office of the Ombudsman. And the failures that I think my office had was that it became very apparent that non-availability of the digital programs was a huge failure on our part, because if we had these infrastructures in our office, would have done better to continue to provide people with the services even during the time of the pandemic. Thank you.
Thank you so much for the answers to those two questions, honorable speakers. Frankie, am I able to put through one more question?
Yes, I can give you 10 more minutes if you have some questions.
Thank you so much. The next question comes from Mrs. Rita Venkataswamy, Ombudsperson for Children of the Republic of Mauritius, who conveys her best wishes, the African Ombudsman Research Center, and lauds this initiative for organizing the AOMA facilitated discussion. The question put forward by the office is, what actions have been undertaken by the African Ombudsman with respect to complaints received from children with disabilities and children living in extreme poverty during lockdown related to COVID-19? I invite any of the members of the panel, any of the panelists.
Yeah, hello? Hello?
Yes, Honorable Mokoko, we can hear you. Go ahead. Unmute yourself.
Thank you.
Philip, please go back to French.
What we did, sorry?
Yes, go ahead, Honorable Mokoko.
Okay, thank you. What we did was that we took into account all the vulnerable people, including the children and all the disabled, and we came up with recommendations that we made to the government to help out the most vulnerable. And the government, in a way, came up with the plans to, go out and in villages through the councillors' offices to identify the vulnerable children, the disabled people, and they were assisted with a variety of things such as food parcels, medical attention, and so forth. And this was an initiative that was coming from the office of the Ombudsman. Thank you.
Thank you so much for that response, Honorable. Do we have any other interventions?
Yes, Madam Facilitator.
Thank you so much.
Can you hear me?
Yes, yes, you may proceed.
Yes, I wanted to say on our part here in Zimbabwe, we, as I indicated, that we're operating as frontline workers. We continued to monitor situations of vulnerable and marginalized people in society, including children, the elderly, even those incarcerated. And we made our various recommendations to the various government ministries and the institutions responsible so they could address the plight of these groups of our people in society. This is part of the continuous engagement that we have had with the duty bearers, meaning government, and all other stakeholders. And we continue to do so that no one is left behind when issues are being addressed to minimize the difficulties people are facing during this COVID-19 pandemic.
Thank you so much for that response, Honorable Mugwadi. Monsieur Talon, do you have any intervention to make?
Juste pour dire que pendant la période, l'institution a gardé le cap en permettant son accès aux personnes handicapées en participant à différentes activités et en lançant des messages lors de la journée de l'enfant, par exemple, population vulnérable. Et je pense que ça, dans notre mandat et dans le mandat de d'autres institutions ivoiriennes, nous travaillons de toute façon la main dans la main.
Thank you so much. Thank you so much, Monsieur Tanon. We have one last question very quickly from Jean Laval Chouet. He says, I believe to be equitable, those individuals who are forced to take the vaccine against their will, otherwise they lose their jobs. For example, their boss or government must sign agreements to take charge of that person if there are any consequences of taking the vaccine, and for example, becoming paraplegic in their lives. I think Mr. Chue wants to find out about the position of Ombudsman institutions regarding the vaccine, the COVID vaccine. I don't know if anybody. He says there is need to have a plan how to ensure survival. But basically, he's talking about the vaccine. I don't know if anyone has any intervention or if there is any official position from any of our officers regarding the vaccine yet. I think.
Yeah, may I attempt a response, Madam Facilitator?
Thank you, Honorable Bugwadi, thank you.
Yes, this is, highly technical, but I believe no one whatsoever has the right to interfere with the right of individuals, the right of freedom of choice. And if someone chooses not to take the vaccine, it will actually be a violation of their rights if they are, coerced into accepting the vaccine. And in any case, we are hearing so far of the negative impact or, the side effects of the vaccine on some people. This makes it even, mandatory for government and other, institutions to relook into the way this thing should be administered. I don't think it would be fair to force it on anybody. Even when we are talking of democratic principles, if you are looking at elections, no one is forced to go and vote. They have to exercise their right to vote. And that's the right people also have in respect of this vaccine, to accept it or not. If I so choose to die because I haven't received the vaccine, so be it. That's between me and my creator, if I may say. It's a very difficult one, but I think those who are at the forefront of this vaccine have to be very careful and considerate of other people's rights and feelings. Thank you.
Thank you, Honorable Mugwadi. And I think with those few questions, we can now wrap up this discussion. This discussion has been an excellent opportunity to discuss the challenges posed by the COVID-19 pandemic in Ombudsman institutions in Africa. I hope the webinar has enhanced the capacity of Ombudsman institutions throughout the continent in their tasks and contribute to the development of skilled resources within the Ombudsman institutions to the benefit of each participating country and Africa as a whole. I now hand over to Honorable Augustine Magona Sotla the Ombudsman of Botswana, and the AOMA Regional Coordinator for Southern Africa. Thank you so much, fellow participants.
Thank you, Madam Sokone, the facilitator. Mine is just to give a vote of thanks. And I'll first of all like to thank AORC for organizing this very important discussion. And in the process, let me also appreciate Professor MacArthur, the acting Vice Chancellor and Head of the Law Faculty, and Advocate Mam Kwebane, President of AOMA and Chairperson of AORC Board, for the welcome remarks they made this morning. I also wish to thank Madam Sokone, the facilitator, for steering us through this morning's proceedings and seamlessly facilitating the discussions on this very important topic. I should also thank our esteemed speakers for the valuable and interesting presentations. I found the discussions, the presentations to be very informative, and I think we have learned a lot from them. They've shared what I would regard as best practices in this environment of COVID. I think we have learned something in terms of how we should proceed with our business, our daily business and operations as ombudsmen's institutions in Africa faced with this horrible disease, the COVID pandemic. My thanks and appreciations also go to my fellow ombudsmen, my colleagues who have participated in this morning's discussions, their staff also, and officers in our offices. Last but not least, let me also thank the staff of AORC, especially my friend Frankie and Marion, for excellently facilitating the hosting of these discussions. I think you have also done very well, as usual. I think we have had a number of virtual meetings since COVID, and I think really you deserve our appreciation. You deserve a big thank you. And I would also want to encourage you to keep on with this kind of discussions, because this is the only way, as it has been said earlier, of us interacting, talking, even though we don't really meet each other physically, but at least we can see each other on the screens. And we can now see that, no, at least we are still alive and we can still continue to carry the light, the torch. And also my colleagues, ombudsmen, God is with us. Let's continue to help our fellow citizens, especially the marginalized, to see to it that their rights, as the chairman of the commission in Zimbabwe has said, their rights are very, very paramount. We should ensure that nobody's rights are breached. And it's quite worrying that with the advent of the vaccine, we don't want to see people being forced to take what they don't want to take. The right of choice should always be safeguarded. Thank you very much, colleagues. Thank you very much. Have a blessed day.
Thank you very much, sir. Thank you so much. Thank you, thank you. Thank you for all our panelists. We really appreciate. Thank you so much. And all the ombudsmen present, thank you so much. Honorable Elasto, Honorable Madame Sokoni, Honorable Mr. Dauda Tanon, Honorable Mokoko. We saw also the Deputy Ombudsman of Angola, Honorable Fobela, who was with us. The Ombudsman of Rwanda, the new Ombudsman of Rwanda was also with us. And we say thank you to all of you. Honorable Nduimana, thank you so much. Please continue to support us. Thank you so much. We really appreciate it. Thank you. Bye for now.
Thank you.
Bye-bye.
Thank you.
Thank you. Bye.
Frankie, thank you.
Bye, Mr. Ewa. Bye-bye. Thank you.
Thank you.
Thank you so much. Bye.
Bye-bye.
Bye-bye. Bye-bye. Thank you.